My name is Dr. Ryan Neinstein. I am an incredibly passionate plastic surgeon here in New York City. My favorite operation. Nothing makes a more meaningful and impactful positive change in someone's life than the mommy makeover, specifically the tummy tuck. Today I'm going to tell you about who the candidates are, how we do the operation, and how the recovery works. So, patients who have stretched muscles or diastasis recti that are giving them a bulge. Here in New York City, we sometimes hear from patients who haven't had kids in 5, 6, 7 years that someone's getting up for them on the subway because they think they look pregnant. We can reestablish that core. Number 2, stubborn fat deposits in the abdomen, the waist, that when the fat is deposited and stuck in the waist, you become square and you lose that youthful, elegant contour. The fat can also go and stick in the upper brow roll and up the back. And then it's the loose skin. If you have loose skin below the belly button without a significant diastasis, we can even do a mini tummy tuck. One of our signature procedures is the mini tummy tuck for the younger 1 or 2 children, fit patient who just may have a little bit of loose skin and diastasis. But let's get back to the traditional tummy tuck and with our modern spin. When we start the operation, we do comprehensive or total liposuction of the waist, the back, and the abdomen. It's been proven to be safe for people who are non-smokers, non-diabetic, people who do not have connective tissue disease, to do the liposuction in the area that we're going to be removing the skin from. We start the procedure by creating that contour. I use Vaser to help melt so we get nice, smooth, contoured results. The lines are long and the look is elegant. Once we get to the abdominoplasty, we get to the point where we're going to do skin removal. I try to keep the incision as close to the vagina as possible so that the majority of it should be hidden in most underwear, most bikinis. But we will make the incision as long as we have to get the contour. I've never seen anyone be upset with the scar when the contour is perfect. Once the skin is up, I will repair the muscles. One of the unique things that we like to do is repair the muscles up and down and also diagonally. It's not just a diastasis recti of the rectus muscles, but also the oblique muscles. When you repair all of the muscles, you contribute to getting those curves back. So you get the curve back by the lipo and pulling the muscles in. We use a long-acting numbing called Exparel, which gives you 3 days worth of numbing, which means you're up and moving faster, pain is decreased, recovery is quicker. Then we remove the skin. Some of the things we do to prevent fluid collections after: progressive tension sutures. We sew the skin to the abdominal wall. VistaSeal, a special sealant that we put inside the abdominal wall. 3 drain. Drains I know are cumbersome and annoying, but are very useful, especially when you're as comprehensive or aggressive as we are. We're trying to do operations, we're trying to win operations. Each patient, it's the most special day of their life, and we approach it with that intensity and seriousness. Talk about recovery. Our patients stay local, meaning across the street from our surgical facility, for 2 nights with a private duty nurse. The nurse is there to reduce anxiety, unburden, unstress, which means someone's taking care of your medications, your drains, and your wound care, and also being there as a mental, emotional, and psychological support. My team, including myself, comes to see you every day. We're obsessed with the journey, the patient journey. It takes about a week to feel normal, but you're showering the second day. At about a week after, you're showering every day, soap and water on everything. You're wearing a foam and a compression garment. You should be able to drive. You should be able to do all your normal activities. At about 3 weeks, we start getting you into a light exercise program. This involves arm movements to get the shoulders, the chest, the back unstiffed and get moving. Light weights on the arms. And legs. We've got ankle weights on, and we start with leg raises. 6 weeks, we're getting back into more hardcore, intense exercise. This is spinning, Pilates, yoga. By 8 weeks, full throttle. In terms of the scar management, first 2 weeks, antibiotic ointment. I'm talking gooey, not creamy. So, bacitracin, for the moms out there, Aquaphor. After 2 weeks, we like a growth factor serum from Skinuva, combined and alternating with silicone therapy. Our patients put their healthy lifestyle with our operation that undoes the changes from pregnancy that cannot be changed with diet and exercise. When you get that combination of a commitment to a healthy lifestyle and super precise, masterful surgery, you can get an exponential outcome in confidence and happiness. And there's been nothing more rewarding in my life than helping so many mothers feel great about themselves.